Hello, everyone. I received a call from the surgeon's office last week, so I have a surgery date, which emotionally is equal parts yay and oh my god. So it's going to be December 2nd, so not too far away. That's a couple months or so. Um, I think I'm pretty much prepared. I just need to pick up some grab bars for the bathroom, for safely getting in and out of the shower. Otherwise, I think I've got everything. Now it's just the mental preparation. Um, oh, and of course, trying to figure out how the family are going to feed themselves for minimum 2 weeks without me helping. So that could be interesting. Anyways, I figured I'd give a quick finish to my medical history. I believe last time I kind of finished off with um, the birth of my middle child, which went really, really well. Um, and then I don't think anything really happened between having my middle child and my youngest child, though during the birthing process of my youngest child, something funny happened to my right hip. To me, it felt like it dislocated for a moment. Let's not go into exactly when that happened. Anyways, it felt like it dislocated and didn't go back right. Um, and then since then, I've had difficulties. It took the doctors a year to believe me that there was something wrong with my hip, because they just believed that because I was breastfeeding at the time that my ligaments were still loose and that it would fix itself, but it didn't. So I've had hip problems since then, and that is why I'm now having hip surgery. So yeah, that's kind of how that has looped around. Other than that, Meniere's disease came in there somewhere. I believe that was after my youngest child was born. It's basically an accumulation of fluids in your ear that your body can no longer get rid of on its own. So dizzy all the time. But I'm on medication I have to take daily, so I don't really get dizzy unless I'm fighting a cold. And then it goes straight to my ears, and my ears bother me. And I have a few dizzy days where I don't really leave the house. Not that I really leave the house much, anyways. Um, so that is manageable. Then the final thing, which I suppose is also manageable but not quite so nice, is the final diagnosis being cardiac syndrome X, which is a rare form of angina where they know mechanically what is happening, but they don't know why it's happening. So essentially, I have a heart attack every 3 to 10 days, randomly, unpredictably. And it's now taking me a good 2 days after the attack to recover and be able to walk around without worrying about collapsing or passing out, because that tends to freak people out. But there's no medical treatment for it, because it's a microvascular blood vessels. There's no form of surgery, no stenting that would help. Um, and we've gone through all the possible medications and nothing has helped. So it's just a live by day, manage it as it happens kind of situation. The one benefit, though, when it comes to the hip surgery, is that as long as it goes well, it is now considered a day surgery, so you're in and out, which kind of terrifies me. But because I have a pre-existing heart condition, I get to stay overnight. So that makes me feel a bit more confident about the whole procedure. So that's it for now. I guess I will next post after I hear from the doctor's office again, because there's going to be a couple more touch points. I believe one is to have to go there for pre-screening, a bunch of pre-tests, probably more x-rays, blood work, that sort of thing. And then there's also supposed to be an educational class But I believe they're doing that over the phone now as opposed to going in person. So I'm not sure which will happen next, but I will let you guys know when it happens. Keep well.